Good afternoon, everybody, and welcome back to the Hope and Healing Conference of Western New York. I'm going to give the hand over to Dr. Kevin Kearns from SUNY Fredonia, who will be monitoring the Fred Talks for the next hour. Again, welcome, and take it away, Dr. Kearns.
Thank you, Melanie, and welcome, everyone. Welcome to our Hope and Healing Conference 2020. As Melanie said, I'm Kevin Kearns. I'm the Interim Provost and Vice President for Academic Affairs at SUNY Fredonia. It's a pleasure to host this session. We're going to have Fred Talks for the next hour. Fred Talks are short, informative presentations with the objective of discussing important issues that are particularly relevant to our community. Each speaker will have 5 to 7 minutes for their presentation. Time permitting, questions will be taken at the end of the Fred Talk session. So thank you for joining us today, and let's get started. Our first speaker today is Steve KILBURN. Steve is the Grant Projects Director at Chautauqua County Department of Mental Health. He oversees 2 federal grants awarded to the department to address addiction in our county. He oversees the Chautauqua Substance Abuse Response Partnership, a consortium of prevention, treatment, recovery, and harm reduction providers working collaboratively to combat addiction in the county. So, Steve, take it away.
Well, thank you very much, Kevin. Thank you, everyone, for participating in the conference today. 7 minutes is not a long time, so I am probably going to talk fairly quickly and take my 7 minutes this afternoon to show off. And when I say I'm going to show off, I certainly assure you it's not me that I'm intending to show off. I'm definitely not showing off the tidiness of my home office here. And I'm really afraid that I won't be showing off any of my technical skills, although I do hope I can share my screen here with you. What I am hoping, though, instead to show off is the work that my role as the Chautauqua County Department of Mental Hygiene Grant Projects Director brings me into contact with. I want to show off in the few minutes that I have this afternoon some of the great work that is going on in our county. And then I also, before I'm done here with my few minutes, I want to show off a very important resource that I hope everybody can find, can remember and find useful going forward. So at this point, I'm hoping that you can see my screen. If you can't, maybe one of the moderators will tell me. But again, my name is Steve KILBURN, and I am the Grant Projects Director at the Chautauqua County Department of Mental Hygiene. And in that role, I oversee the Chautauqua Substance Abuse Response Partnership. And this is a collaborative work of multiple agencies across our county from all sorts of perspectives addressing the issue of addiction here in our county. And so those agencies you can see there, but they represent prevention, treatment, recovery, and harm reduction agencies. And it is a genuine privilege that I have to be able to work with these terrific folks. And I want to show off a little bit, and in fact, I've been able to show off some of this great work that our county has, and it's important that you and I are aware of how much is going on surrounding the issues of addressing addiction here in our county. It's important not just so that we feel good about ourselves, it is important because it makes a difference in the hope and healing that occurs in our county. As I said, I've had opportunities to kind of show off some of the work that I have the privilege of, the folks that I have the privilege of working alongside and partnering with, in particular through a series of videos. I hope many of you have seen the Let's Heal Together videos that we have been putting together mainly over these past couple of months. But if you haven't, I want to give you just a little taste and let you get some sense about how much is happening in Chautauqua County that is worth celebrating.
We provide basically some social emotional learning as well as substance use prevention with children as well as adults and seniors throughout all of Chautauqua counties.
Unique about the Mental Health Association is that we're a peer-run organization, and everyone who works at the Mental Health Association.
A full range of service behavioral health clinic. We offer both mental health counseling as well as chemical dependency counseling, both individual and groups. We have an MAT program here, which is medication-assisted treatment. And we also offer a full range of...
I know medication-assisted treatment saves lives, and it works. And I see that people improve the quality of their lives every day.
I hear that all the time. You know, had I known these services were available, had I known your program was out there, had I known there was Suboxone out there, I would have done this a long time ago.
Continue to encourage treatment. Again, we want to make sure everybody understands that treatment is an essential service, and those resources are still available to everyone, and we encourage them to seek it out.
Become stable, have jobs, continue engaging with their families, live healthy and happy lives. And I often equate it and I say, you know, if you had diabetes, I'd be giving you medication for that. You have an addiction and I can give you a medication that can make it so that you can function.
Yeah, we've had almost 500 people come in and let us know that they've saved the life of someone.
Well, I hope that gives you a little flavor of the kinds of things that are happening here in Chautauqua County. And those full videos you can access on the Combat Addiction CHQ Facebook page. And just Google that. But before I wrap up, and I know I only have just a minute or two, I just want to underscore this important message that is, again, not really just showing off. It is so important for the help, rather the hope and the healing that takes place in our county, that we begin to change any narrative that continues to exist, that resources are limited in Chautauqua County. The fact of the matter is we are very rich in resources for addressing the issues of addiction. And that is by no means trying to minimize the very serious and real challenges that continue. We also have those, but we have a lot of resources. We have resources from Prevention Works, for example, and that is a very aptly named agency. Their work works, and they are in all of the school districts, for example, around our county. We have multiple agencies licensed by OASIS, licensed by OMH, FQHC here in the county, who are all providing substance abuse treatment. In fact, we have approximately 18 waived providers able to prescribe buprenorphine in Chautauqua County. And if you have any sense of the circumstances in other rural counties around the country, you will know that 18 providers, at least, I believe, is a remarkable number. And in fact, in some counties, there are none. We have a terrific recovery agency, the Mental Health Association, and I'll steal no thunder from Stephen Cobb, who follows me here with these Fred Talks. And then finally, Evergreen Health, whose services have literally saved hundreds of county residents' lives. This is a message that I hope we can all take away, namely that there are resources available, and changing that narrative, I think, is so important because it does inspire hope amongst people for whom any perspective that resources are limited or hard to access can be a barrier for them getting treatment. People need to know what is available here in our county. They need to be able to find it, and I recognize that that is a barrier, and that's the resource that I want to highlight before I do finally close my, I hope, 7 minutes. CombatAddictionCHQ.com. Sometime today, I hope, if you haven't already, you'll visit this site, CombatAddictionCHQ.com. Here's a screenshot of that website. We're very excited about it. It's fairly new, but we are very excited about it, including the fact that on that very site, there is a resource locator: prevention, treatment, recovery, harm reduction, and family supports. A kind of one-stop shop for people in Chautauqua County to find what's locally here in the county and around our region. Carry that message out. People need to know what's available, how to find it. And then, of course, they need to want it. And we all know that motivation is a challenge as we seek to bring hope and healing in our community, but changing the narrative about what's available here in our county can only help improve the motivation as well. So thank you all for your attention. I hope I haven't gone much over 7 minutes, but with that, I will turn off my screen share and my camera.
Thank you, Steve. We really appreciate that wonderful overview of services. Next, as our Fred Talk speaker, I'd like to introduce Steve COBB. Stephen is the Executive Director of the Mental Health Association of Chautauqua County. He received a Bachelor of Fine Arts from NYU. He's a certified peer specialist and certified Teach to Mental Health First Aid, CCAR's recovery coach, Academy and Ethics for Recovery Coaches. He serves on the board of the Chautauqua Leadership Network and Vestry of St. Luke's Episcopal in Jamestown. Please welcome Steve as our next speaker.
Hi, good afternoon, everyone. It's great to be with you. I'm coming to you from Jamestown, where we're working really hard to get our recovery centers open in the next couple of weeks, so we can go back to engaging in some face-to-face support, of course, with social distancing and all safety measures in place. But I wanted to present a little bit about what is a recovery coach and what do they do? Recovery coaching, or peers, it's somewhat new to our county, and we often find there's confusion as to what it is exactly that they do. So I just want to touch on some of these things as what a recovery coach is. So if we go to SAMHSA and look at the definition of what recovery is, it's a process of change through which individuals improve their health and wellness and live a self-directed life and strive to reach their full potential. And I love this definition, but I think it's important to remember what's not in this definition. Nowhere in here does it mention that somebody has to be perhaps abstinence from their drug of choice. That might be a goal we want people to work towards, but it's not part of being defined as in recovery. Or it doesn't say in here that someone is compliant with all their medication or compliant with their treatment appointments. All of those goals we want people to work towards, but the language that we use in supporting people is in recovery is so important. And to just be clear what recovery is, it's a pretty simple definition. These are the guiding principles of recovery that at the MHA as coaches and peers that we embrace. One, that recovery is self-directed. That the person who is in recovery sets the goals and determines the path that they're going to walk on with those goals. That recovery is strength-based, that we focus on strengths and capabilities and talents and skills first, because when you build relationships with people based on their strengths, the relationship is enormously powerful to help move them along a path of recovery. We embrace the concept of empowerment, and we provide as coaches the tools that people need to go on a path of recovery. We embrace the concept of basic needs, that when everyone enters recovery, the first thing we need to do is make sure those basic needs are met. And as coaches and as peers, we look at those needs. Do you have food? Do you have shelter? Do you have clothes? Nobody can begin to concentrate on healthy living until those things are taken care of. And we provide hope. Hope is in the title of our conference. People do recover and that change is possible. Hope is so important for people in recovery, but also the larger community as a whole. I had an opportunity recently to be at a conference with a large gathering of treatment court judges, and one of the judges was talking about how difficult it is to work with somebody who has a substance use disorder where their primary drug of choice is crystal meth, and he felt that there was no chance of recovery. Well, I was able to share with that judge the fact that I was a crystal meth addict and had been sober for 10 years. So in that role, I wasn't providing hope for just somebody who's in recovery, but also hope for a judge who needed to know that people who use crystal meth can find recovery. We embrace the principle of optimism, that you can do it and that many people do it also. We embrace the concept of positive self-identity, that you can be recovery focused and you don't need to focus on the disorders. You don't need to focus on the substance use disorder or the depression or the anxiety. And we embrace the principle of being of service. And the foundation of that often comes from 12-step recovery, that once you get sober, you move forward and you embrace service to those of you who are following you on your path. And that brings us to the core values that we embrace as recovery coaches, that all individuals are unique and they have special needs and goals and expectations for their own recovery. The path that I went on to achieve recovery is not going to work for the person who I am helping. There might be components of my recovery that could help that person, but just because I was successful in a path that included 12-step recovery does not mean that that's true for the next person. Premise 2 that we embrace, that persons in recovery with mental illness or substance use disorder or even addictive behaviors such as gambling or eating, that we share similarities. However, management and mastery of their futures will at times require different paths. Premise 3, all persons should be offered equal access to recovery and have the opportunity to participate in their recovery process. And I think one of the things that we remember as coaches, and I want to share with everyone, is that everyone should have equal access all the time to the recovery process. If you haven't been successful in the first 3 times you've entered recovery, you are still entitled to that 4th try or that 5th try, or maybe even that 6th try in recovery. There we go. So, and another thing that's important for us to remember, and as coaches and peers, we embrace this, is that how do we know when someone is in recovery? Is that based on a talk screen, or is that based on no encounters with law enforcement? And while those are things that we strive for, and we know that healthy living would take us away from those things, we remember as coaches that somebody is in recovery when they say they are. So if that person is working with a coach and they've stopped using one substance but are continuing to use some other substance but still identify themselves as being in recovery, we embrace that and move forward. So looking at what a recovery coach or peer is, CSARP, which is one of the training organizations that provides training for coaches, defines a recovery coach as anyone who's interested in promoting recovery by removing barriers and obstacles to recovery, and by serving as a personal guide and mentor for people seeking recovery. And thinking of the roles and responsibilities of a recovery coach, this is what we try to do to help move people forward. We're a motivator and a cheerleader, believing in their capacity to change. We motivate and encourage and celebrate successes. We're an ally and a confidant. We are a truth teller. Many times recovery coaches find themselves in a position where we're able to tell the truth. Our lived experience of our own recovery it sometimes gives us an ability to question somebody who is in a path of recovery. We are a role model and a motivator. We're a problem solver. Identify potential areas of problems that people might encounter on their recovery path because we have that experience. We've already been down that path. We're a resource broker. We connect people to services in the community. Not only do we connect them, we're also able to go out and go on that path with them. So if somebody needs to get connected in early recovery with connections for food, we can actually take them to the food pantry, or perhaps go with them to DSS to help them go through that process of determining eligibility for SNAP. We're advocates for both a big A and a little a. So the little a is for the actual recovery that we're working for, but we're also an advocate of a big A with for recovery in our community. We're community organizers. We help to establish networks of recovery supports, whether it be meetings or recovery centers or sober activities that happen outside of treatment facilities and recovery centers, so people can learn how to socialize in a sober or healthy environment. We can actually, we're a lifestyle consultant in regards to a recovery lifestyle and what that's like. Recovery coaches are also friends and companions, and I don't mean friend necessarily by a deep, close personal friend, but friendship in the larger sense of humans and friendship and companionship. And one of the things that also falls under this category different is the power differential between a peer and a recovery. We're equals, and we work together on a path of recovery. So, and we can just be clear here on a few things that a recovery coach isn't. Recovery coach isn't a sponsor or a counselor or a nurse or a doctor or a rabbi. We promote recovery goals, we remove barriers, we connect people with recovery support services, and we encourage hope and optimism in healthy living. And just to finish up, thinking of where do we go from here? We know of peers being in those traditional environment of recovery centers, but at the MHA, we're really working to figure out how peers interact in the community where people are. We've been able to place peers at the Chautauqua County Jail to help people who are transitioning out of the jail, to at Chautauqua County Family Court to connect with people who present and have issues there, to support parents through that process towards a path of reunification. And our OD mapping program actually sends people out into the community to respond to overdoses. We're averaging about 92% of people of reported overdoses in Chautauqua County, where we're connecting with those people and connecting them with recovery and treatment services. And last, our OPEN program, our occupational peer empowerment network, where peers are actually going out into workplaces in our community like Cummins and Weber Knapp to connect with people who might be struggling with mental health or substance use disorders, to support them so that they don't have to lose a job. Thank you for your attention.
Thank you very much, Steve. We really appreciate your insight and sharing your story. Our next Fred Talk presenter is Kelly Potter. Kelly's worked with youth and families for over 30 years in public health and wellness. She's currently working as the Hope Chautauqua Project Director and Coalition Coordinator. She's managing the Drug-Free Communities Grant, the State Opioid Response Grant, and the Partnership for Success Grant. She serves on the board of directors of several not-for-profit faith-based organizations, such as Breathe Life of Western New York, and she collaborates with multiple organizations on reducing the availability of prescription pain meds in the homes and in the communities of our county. So please welcome Kelly.
Thank you, Kevin. Good afternoon and welcome. We are so happy you're attending the Hope and Healing Conference today. My name is Kelly Potter, and I'm the Project Director Coordinator for Hope Chautauqua Substance Abuse Prevention Coalition, that is an initiative of Prevention Works in Chautauqua County, New York. Today, I want to briefly discuss how we can make a difference by being more responsible on the way we communicate, as well as our behavior in regards to substance use and the impact it potentially could have on our youth if we don't act responsibly. In the midst of COVID-19, there has been an increase on social media platforms and TV sitcoms and ads promoting alcohol consumption as well as other substances. In addition, youth may also have easier access to those substances in their homes and community where they reside. Normalizing these behaviors have the potential of escalating the risk of youth engaging in unhealthy and harmful behaviors. Research shows it takes 25 years for the brain to be fully matured, and the last part to be developed is the prefrontal cortex, responsible for decision-making, higher reasoning, judgment, and self-control. During this period of growth, the environment can influence the way a youth acts, thinks, and feels. It's so important as adults we take the time to observe, listen, and communicate with our youth while modeling positive behaviors. In 2019, 1,149 Chautauqua County students in grades 8th, 10th, and 12th were administered the Pride Youth Development Survey. This is a snapshot of Chautauqua County, and it may be very similar to the community you live in. In Chautauqua County, 27% of youth stated they used alcohol in the past 30 days. 18% of youth stated they used any form of marijuana either by smoking or vaping in the past 30 days. And 25% of youth stated they accessed alcohol from home with their parents' permission. We need your help to reduce these numbers, and here are 3 tips on how you can help. Tip number 1, lock it up. One of the easiest places to get alcohol is the refrigerator. Don't keep alcohol such as beer or wine where teens can easily access it. Safely store prescription and medical marijuana in a locked cabinet or a locked storage bag. Dispose of any unused prescription meds at a local Dropbox location site or in the comfort of your own home using an environmentally safe disposal bag. And FYI, for those of you who live in Chautauqua County, Hope has free disposal and storage bags available, so please contact us if you or someone you know needs one. Tip number 2, don't be the party. We are living in a time where alcohol consumption and substance use is on the rise. Teenagers have been quarantined over the past few months and parents are struggling. At Hope, we call them quarantinagers. They are scared, anxious, and frankly, in some cases have worn their parents out. This, however, is not an excuse for parents to think it is okay for teens to consume alcohol or other substances to ease their pain. They need guidance now more than ever. This is our time to be more diligent in our efforts to educate parents on the dangers of underage drinking and substance use that may be occurring under their roof, and the fact remains, it is the law. And today, there's so many prevention resources available in our community. Here in Chautauqua County, we have our prevention provider, Prevention Works. And they offer a number of programs, services, and trainings and resources to educate the community on positive life choices, as well as encourage and support healthy behaviors through prevention efforts. The Substance Abuse and Mental Health Association, SAMHSA, Talk, They Hear You app features an interactive simulation that helps you learn the do's and don'ts about talking with kids about underage drinking. And the Office of Addiction and Support Services, OASIS, features the Talk to Prevent Parent Toolkit that provides informational pamphlets and guides for practicing prevention at home. Tip number 3, be careful what you post on social media. Social media messages have the potential to influence a youth's decision on alcohol consumption, marijuana, and tobacco use, as well as vaping. Adults need to be aware of the implications of what they are posting and sharing on social media platforms such as Facebook, Instagram, and Twitter. This may seem innocent, however, it may also motivate youth to mimic and act out on some of those behaviors. Parents, caregivers, educators, counselors, and so many others, including all of you, are the biggest influence in a youth's life. And you as a community member have the power to influence environmental change in your home, village, town, city, county, and the county you reside in. Prevention works, and you can make a difference. There are many local, state, and federal resources available. Locally in Chautauqua County, we have the Hope Chautauqua Substance Use Prevention Coalition and Prevention Works, our county's prevention provider. At the state level, we have the New York State Office of Addiction Services and Supports, OASIS, and at the federal level, we have the Substance Abuse and Mental Health Services Association, SAMHSA. For additional information on the resources listed above or any questions you have in regards to my Fred Talk, you can contact me at kelly@preventionworks.us or at 716-363-2051. Thank you all and enjoy the rest of the conference.
Thank you, Kelly. We appreciate it. Thank you for the information. Our next Fred Talk speaker is Annie Rosenthal. Annie works at the Chautauqua County Department of Mental Hygiene as the Public Relations Coordinator. She oversees department and grant-related communication for local mental health and chemical dependency services in Chautauqua County. And she provides prevention and awareness information using safe messaging. And he also serves as the president of the board of Trans Family of NWPA, which supports the transgender community of Northwest Pennsylvania, as well as those who are questioning their loved ones, family members, and allies. So please welcome Annie as our next speaker.
Hello, everybody. My name is Annie Rosenthal. My pronoun are she, her, and hers. I'm the Public Relations Coordinator for Chautauqua County Department of Mental Hygiene and Board President of Trans Family of Northwest Pennsylvania. Today, my presentation is how to be the best ally you can be to the LGBTQ+ community. Being an ally, being a friend to an individual or a community is a great way to show that you care about someone's mental health and well-being. I'd like to wish everybody a happy June, a happy Pride Month. Pride Month occurs in the United States to commemorate the Stonewall riots, which occurred at the end of June in 1969 at the Stonewall Inn in the Greenwich Village neighborhood of Manhattan, New York City. As a result, many Pride events are held during this month to recognize the impact of the LGBTQ community in the world. Unfortunately, this year, many Pride events have been postponed and rescheduled due to COVID-19, including Jamestown Pride, which has been postponed to June of 2021. So what does LGBTQ+ mean? The first three letters, lesbian, gay, bisexuals, refers to sexual orientation or preference of a person. The T, transgender, refers to a person whose sense of personal identity and gender does not correspond with their assigned sex at birth. This is gender identity. The Q refers to queer or questioning. Queer is a term people often use to express fluid identities and orientations, often used interchangeably with LGBTQ. Questioning, a term used to describe people who are in the process of exploring their sexual orientation or gender identity. The plus refers to any and all other terms related to sexual orientation and gender identity. This can be intersexed, someone who was born with both sexual characteristics at birth. Two-spirit, which is a Native American term. Androgynous, allies, the list goes on. Remember, the LGBTQ+ community is a community of communities. So an important thing to remember is gender identity is different than sexual orientation. Gender identity is your own internal personal sense of being of a man or a woman, or as someone outside of that gender binary. Sexual orientation describes a person's enduring physical, romantic, and/or emotional attraction to another person. For example, straight, gay, lesbian, or bisexual. So let's define allyship. An ally is a person who does not identify as part of the LGBTQ+ community, who wholeheartedly supports legal and social equity for LGBTQ+ people. An ally is a person who is not offended if assumed to be LGBTQ+, and who doesn't reinforce their non-LGBTQ+ status. An ally is a person who recognizes their heterosexual or cisgender privilege and works to undo it. Cisgender refers to a person whose sense of personal identity and gender identity corresponds with the sex they were assigned at birth. Being an ally means being a friend to the LGBT community and giving your support whenever possible. An ally is not a title. Ally is an action word. Don't ever make assumptions. It's important that someone has preferred pronouns. If you do not ask someone's preferred pronouns, don't ever make assumptions. Please ask. Most people don't mind answering. Speak up whenever possible. If you see someone misgendering someone or calling someone names or being disrespectful to someone based on their gender identity or sexual orientation, speak up, say something. They'll appreciate it. And get involved and give your time. There are many events in your community. There are many groups, support groups, awareness groups, and otherwise that really would love to have your help and volunteer hours. Reach out. Have you done any of these things? Then you're already an ally. Keep up the good work. If you haven't, now's the great time to start. So I wanted to highlight some local support groups. Through the MHA, there's the Southern Tier Queer Peers. You can contact Sheridan Smith. We have his email here. There's also a transgender support group of Jamestown, New York. You can find them on Facebook. They have a private group, but they have their information posted, so if you want to reach out and ask how you can help. And then Trans Family of Northwest Pennsylvania, group I'm associated with. We have a Facebook page, and we'd love to hear from you as well. Please reach out to us if you have any questions at all. Some other resources I wanted to share. It's always good to look into other things. The Human Rights Campaign. Here's a link to a glossary of terms. Lambda Legal. Lambda Legal is great for legal issues, and they have some great articles of how to support youth. Youth are a very important part of the LGBTQ community. And the Trevor Project. The Trevor Project gives resources around LGBTQ+ youth, mental health, and suicide prevention. Thank you so much for your time today. Feel free to contact me. My email is below. Thank you so much.
Good job, and thanks, Annie. Our next Fred Talk speaker is Patrick Swanson. Patrick has served as the elected Chautauqua County DA since 2016. He was a prosecutor, has been a prosecutor since 2012, and defense attorney from 2008 to 2012. Patrick is also a member of the board of directors of the District Attorneys Association of the state of New York. Welcome.
Thank you, Doctor. Thank you all for having me and stepping into this Zoom seminar to hear a little bit about what's going on in this county and around the state. My hope is that the internet for the county holds my Wi-Fi signal well enough. And Kevin, can you confirm that you're hearing me?
I can, loud and clear. Thank you.
Excellent, because you froze for a moment. All right, so many of you may be asking, what's the role of a prosecutor in the prosecution office and in all of this, and hope and healing and finding helping people find recovery. Well, I would suggest to you all that it's pretty extensive. Over the last 5 years here in Chautauqua County, in particular, we've seen the numbers of folks struggling with addiction continue to increase. We've seen the numbers of folks being arrested with possession of an illegal narcotic increase. And our concern, obviously is what can we do to steer these folks into recovery? And we have a number of programs within the criminal justice system at this point in time that hopefully steer people in the right direction, get them the help they need, and ultimately send them down a path to a life of recovery. Right now, we have a very robust drug treatment program in our courts. One's housed in Jamestown, one's housed in Dunkirk. Our office is also a member of what's called the Care Coordination Council, and that was originated by George Borrello a number of years ago. And we participate in that, in mapping and speaking with law enforcement and other officials involved with recovery programs to help kind of coordinate services for folks, whether they're arrested or whether they're not arrested, to help them with recovery. We are a partner in the opiate court, which was begun up in Dunkirk from its inception. Judge Farrelletto, who's the administrative judge for the 8th Judicial District, approached me, asked if we would be interested in a diversionary program to assist folks with opiate addiction. And of course, we jumped on that immediately, given the numbers that we are seeing in our county of people being arrested that were claiming to have some sort of addiction to opiates. Excuse me. That program is open to people even if they haven't been arrested. So getting the word out that you can take yourself to Dunkirk City Court, show up, ask for help, even if you've not been arrested, I think is a step in the right direction for our criminal justice system. We are also involved with the OD mapping that you heard Stephen Cobb talk about. We have an investigator in this office that's tasked with monitoring that, looking for hotspots, which allows us to coordinate law enforcement response to any outbreak of overdoses. And then finally, we have a partnership with our U.S. Attorney's Office where we are aggressively going after the people who are selling these illegal drugs to the people struggling with addiction. So we're doing a number of things here within the office with the goal to reduce the number of people out there struggling with addiction. And the reason why that's beneficial is folks, unfortunately, in the throes of addiction, they will commit quality of life crimes to support their habit, and they also drive a drug trade that's violent inherently. So, our interest in helping people recover is great. It drives down quality of life crimes, and it drives down the drug trade, and ultimately see a decrease in crime numbers. The unfortunate thing is over the past decade in this county, in this state, in this country, we've seen opiates take hold. And more recently here, and it was interesting, there was a question that came up in the chat with Mr. Cobb. There was a question about methamphetamine, which seems to be the most problematic drug in our county right now. But coordinating all these services and getting the word out to the public so that they're aware that people, that you have the option to get help, I think is one of the more difficult obstacles to overcome, or at least that's what being a part of the Care Coordination Council has taught me. But really, as a member of the Board of Directors of the DA's Association, this is a topic that concerns many DAs across this state. There's a drug problem that everyone has concern with, and really finding alternatives to prosecuting and being draconian and punishing people for something that they're struggling with really isn't in the best interest. I think that's what the research out there shows, and we have a real interest in helping these people through diversionary programs where they can walk away, ideally, with some form of recovery, or at least on the road to recovery or full recovery, and allow them to live productive lives without a criminal conviction. And many of the programs that we have, steer people in that direction. allow them to avoid a crime in their background, and it's beneficial to everyone involved. But today's prosecution is very different than it was 25 years ago. We aren't locking people up and for struggling with something that's been called a health crisis. So we have an eye towards that. We work hard to help our citizens that are struggling with addiction. And in keeping in theme with this conference, I want to just touch on 3 cases that really I think typify successes that we've had in our criminal justice system with recovery. I prosecuted as an assistant DA here before becoming the DA, and there were 3 cases that I handled that had exceptional outcomes. One was a middle-aged gentleman struggling with addiction to alcohol. He had a number of DWIs at the same time. Really someone that you look at first glance and you think there's just no chance that they're going to get through this. He went through our drug treatment program successfully. I've seen him now out in public a number of times, and he's doing extremely well. I had another young man who was struggling with opiates. His father was involved in law enforcement in this county. He was in really rough shape when he came in. I remember the way he looked. I couldn't believe just the effect physically it had taken on him. He struggled a little through the drug treatment program, but he made it. I was out in my yard doing some yard work, I don't know, 2 years ago at this point, and a young man comes walking by with a book bag, stops, kind of looks at me for a moment, and he says, "Mr. Swanson," and I'm like, "Yeah," and the young man says, "Thank you. I'm in college at JCC." He gave me a little bit of what was happening in his life, and he had turned that corner, and he was doing very well. And finally, I have a young man who was former military, struggling with methamphetamine, had an issue. He got caught up in a crime. He went through the drug treatment program very successfully. I got a message from him on Facebook Messenger just some short time ago where he was requesting some assistance in finding an apprenticeship program for one of the trades, and I was able to direct him into that. He's now married, has a child, a house. But those are the kinds of things that I want to tell people about that we're doing here with the district attorney's office and helping people get through their struggles. And there is some light on the other side, or a light at the end of the tunnel, as they say. And really our goal here with a lot of our drug cases is to assist these people, get them through what they're struggling with, and turn them into productive citizens. And I think we've had some success here. I want to thank you for having me on. I probably used up my 6 minutes at this point, but Doctor, thank you for having me. I think this is a great program, and I hope people can take away from this all the services that are available in Chautauqua County, and just know that there's help out there for them.
Thank you, Patrick. Great job. We really appreciate your service and informing us about your services. So moving on to our final speaker, please welcome Deborah Maggio, who's representing Rachel Ludwig. Deborah is the marketing coordinator for the County Department of Mental Hygiene, Health, Home, and Upstate New York for Southern Tier. She's worked within the health and wellness industry for over 30 years, has a passion for assisting others to discover total wellness and help them gain the necessary tools to achieve it. She's a National Academy of Sports Medicine certified professional trainer and holds other fitness certifications. Rachel is the project director for Chautauqua Tapestry Resilience Initiative in our county. Rachel is a licensed clinical social worker with over 20 years of experience in child and adolescent therapeutic interventions and family therapy through direct practice and administration for the community, residential, and governmental settings in Pennsylvania and New York. Please welcome Deborah, who's representing Rachel.
Good afternoon. I'm honored to bring you the words today of Rachel Ludwig, who is unable to speak to you directly today, but I will do my very best to share her voice. In a time like this, in a place like this, looking for hope and for healing, individual hope and healing, community hope and healing, pandemic healing, social hope, For a few minutes together now, we can find some hope and healing through self-care, through awareness, and through shared peace. The term self-care can be brushed past as common, perhaps seemingly overused. But as we wrap up our Fred Talks today, I suggest that you give an honest reflection about how you are caring for yourself in this time. How are you maintaining a new normal? Give yourself a chance to be strong, to be authentic, and to recharge for all that lies ahead. Symbols, colors, quotes, and images can all be power tools for reflection. I ask you to think for just a minute through a few of these as we see together, as we are open together, and as we are we together. Start with a feather. Feathers can symbolize many things. What do they mean to you? Lightness, flight, freedom? How about transcendence, seeing bigger and having no limits? Feathers may hold a spiritual connection, a sign from an angel. Finding feathers may lead me to ask if my dog caught a bird. But when a feather is there, almost magically, it can feel like, in Forrest Gump, when a feather floats down on a box of chocolates, you never know what you're going to get. The important step, of course, is how we respond. This is the Chinese symbol for crisis. It combines the symbol for danger with the symbol for opportunity. Just the word crisis can invoke a strong response. Look at the symbol here and consider all that got us here today. Also the balance, the grace, the strength, the opportunity. Today and each day holds some things within our control. Some things are outside of our control. Hope and healing, seeing the light in the dark, flipping the switch, being the light in the dark, looking thoroughly at your surroundings, seeing past yourself to see what is. Self-care is merely the act of intentionally prioritizing your physical, mental, and spiritual health. It is seeing past yourself and seeing in and through your tunnels. Not practicing self-care can lead to burnout, feeling stressed and overwhelmed. It mirrors the symptoms of depression, feelings of fogginess, confusion, and disconnection, lack of self-satisfaction, inability to make decisions. You can make your own silver linings playbook. Maybe you're inspired by color. The color orange represents creativity, emotional balance, intuition, harmony, and expression of emotions. Looking now at this color, check in with who you are. Sitting quietly, feet planted on the ground, feeling safe, feeling open. This is not a traditional conference. You are not sitting right next to your team, your colleagues. This is a crowd of almost 400 that fits within the screen you are attending through. Check in with yourself. How is it that we are pretty used to seeing PPE? Face masks at least. How many face masks have you worn over the last few months? Flight attendants have long directed our behavior on a plane. If we lose air pressure in the cabin, oxygen masks will drop from the overhead area. Please place the mask over your own mouth and nose before assisting others. I would be surprised if each of us have not felt a wave of panic. A mask can be a symbol also of action and reaction. Now we all have to wear face masks, seemingly all the time. These are not for oxygen, but they are to save our lives. Another thing that masks do is block up to 85% of communication. We can't see if someone is smiling or cringing. Our speech is muffled and filtered when wearing these masks. It's a strange, new normal. Here we are from our many points of entry. It's been different, right? Kids are schooling from home. We are learning and working from home. We are not visiting the same way. Home is a sanctuary, but not for everyone. Our fear may come out in anger, our desperation and frustration taking out on others. This world feels so different. Isolation. Is this self-isolation? Is isolation painful? It can be. Life can be painful. If you can relate to this image, know that you are not alone. Even when you are, I think we have to rethink what alone is. Alone can be alleviated by sharing and by connecting. There's a Swedish proverb, shared joy is double joy, while shared sorrow is half a sorrow. A strong message here from Malcolm X. When I is replaced with we, even illness becomes wellness. More images and symbols thinking of terms of we. As you see this giant we, what stands out to you? Be generous, unite, interact. Have fun with we. You can take a Jimmy Fallon approach. Thank you, Wegmans, for staying open to be sure we all have the food and essentials we need and more. Thank you, Wendy's, for providing us delicious Frosties. Thank you, Webb, for letting us have access to much more information than we could ever need. Hope and healing, looking for silver linings, looking to the bright blue sky. According to Healthline, it takes 18 to 254 days for a person to form a new habit. Most people say 21 days, and really that's a good rule of thumb. The point is that it's not automatic, nor is it one and done. We have been in this pandemic since mid-March, about 12 weeks, and we have had to develop some new habits. What new habits have you had that you're moving along a healthier track? Can you hold on to them once you don't have to? Don't forget to balance your self-care. Balanced self-care addresses all areas of health in order to enjoy a well-rounded and balanced life. Physical, nutrition, sleep, hydration, exercise. Mental, managing stress levels, seeking clarity, balanced mood, and managing anxiety. Emotional, hold secure boundaries, seek and feel joy, build positive thought patterns, balance your time. Spiritual, connection, stillness, higher power, routines and traditions. Intellectual, growth, stimulation, commitment to development. Here's a simple glance and a fun short reminder that you can make positive habits. You can change for good and maintain the habits you wish to keep. I hope that you have a little bit less tension and that you see some hope and have some release. Don't forget to find what moves you, what inspires you, and be the change you wish to see. With symbols and hope, I wish you all well. Thank you.
Thank you, Deborah and Rachel, and thanks to all of our speakers for their information and insights. And thank all of you for attending. Unfortunately, we don't have a lot of time for questions. We are fortunate that everyone provided their contact information. So please feel free to reach out to our speakers and to one another. And I hope you enjoyed these Fred Talks as much as I did. So this concludes our Hope and Healing 2020 Fred Talks for today. Have a great day, and thank you all very much.
Wonderful. Thank you so much, Kevin Kearns, for helping out during the Fred Talks, and thank you everybody that came today to give a little bit of a snapshot of your agency and a message that's very powerful for our community. We are going to take this time for a break. So we do have 15 minutes before our next session will be coming on. The next session that's up is going to be a presentation from Trish Whetstone and Alex Rodriguez, and it's on new trends with CBD and Kratom. It's a brief overview. So feel free to grab a drink of water, take a quick stretch, and we'll be back shortly.